This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care to me means convenient, comprehensive, and compassionate care. It's the bond of trust between a patient or a patient family and physician while bringing that joy back into the practice of medicine. To me, it's the opportunity to be the kind of pediatrician I want to be and the kind of pediatrician my patients and families deserve. I'm Dr. Alia Hussain with Creekside Kids Pediatrics, and this is my DPC story.
Dr. Alia Hussain has many years of pediatric experience. After residency and chief residency at NYU Winthrop Hospital in Long Island, New York, she moved to Jackson, Mississippi, where she had a busy solo pediatric practice for a few years. For the last few years in the Woodlands area, Dr. Hussain has passionately provided care to children from newborns to teens. She discovered direct pediatric care and chose this model of practice so she could have more time with her patients and provide them with the care they truly deserve. Dr. Hussain lives in Creekside with her 3 kids, ages 11, 7, and 2. She is an advocate for breastfeeding, and having been a busy mom, she has the experience and expertise to provide support and advice to her patients and their families. She opened Creekside Kids Pediatrics in November of 2020. Welcome to the podcast, Dr. Hussain.
Thank you for having me.
Last season, we were supposed to have you on the podcast and things happened, but now you are about to approach your 2nd anniversary in your practice. And so I think this is even more of a power punch of an episode because you have all of that experience underneath your belt.
Absolutely. So now I can speak to you with, this whole last year and a half worth of experience. In the beginning, it was a kind of rocky road and a completely unknown territory. So now definitely more to say and more to discuss with you today.
I love that. And I want to start with having the audience hear about your journey, because your journey has definitely been a vast journey geographically. You went from Connecticut to New York to Mississippi and now in the Woodlands, Texas. So can you tell us about your journey into medicine and your journey before opening your DPC?
Sure. So my journey of medicine probably even started like in childhood because my dad was a physician. So, even from the beginning, I was exposed to that way of life and he always put his patients first. And so even from early on, I was exposed to medicine. After boarding school, I actually went to medical school in Pakistan, which is where my family's from. I was at one of the oldest medical schools in Pakistan. And so I saw a lot of disease pathology that maybe I wouldn't have been able to here in the States. And then I moved back. I was in Boston for a bit, so I did some research there at Harvard, and then I moved to New York for residency. And I was just lucky enough to be at a very busy hospital, level 4 NICU, PICU, so a lot of experience there. And then we moved to Mississippi, which obviously nobody thought we would do from the Northeast, but my husband got a GI fellowship down there. And so I ended up being a solo doctor right out of residency, thrown into my own practice. It was a hospital-owned practice, like completely Medicaid. And so it was just a great experience to, get that initial how I wanted to practice. And get a lot of experience there. And then we moved to Texas because that's where we wanted to raise our family, and we had some family here. So that's where we are now for the last 6 years.
I think that's so awesome that you have all of that experience under your belt going into DPC. I mean, now you even have a year and a half plus of experience in DPC, but I just love that you bring all of that to the table. Now, I want to ask, when you were in that journey, at what point did you learn about DPC?
So I think about 5 or 6 years ago, my brother and sister-in-law, they had their first baby in Florida, and they joined some sort of a concierge DPC type practice for their baby. And, I had a lot of the same questions that some of my patients or people that call in ask, like, why would you join this practice when you have good insurance? What's so special about it? And at the time, I think I was in, right out of residency and working for an insurance-based practice. So that's when I initially got exposed to it. But when I really learned about it was during the year before I started this practice. And I joined just kind of exploring different options, joined a Facebook group with other DPC pediatricians, which was just, so much knowledge there and so much I learned so much from them. And that's when I really learned what it was and how people are just sort of building their own practices. They're all unique. All DPC practices are kind of their own, just built very differently and how a physician wants to practice. So
at what point did you decide that you were going to open up your own DPC?
So I was on maternity leave with my third child, and I decided that I didn't want to go back to my previous position at a large, 5 or 6 different doctors at that last practice. And, I was seeing 30, 40 patients and just, just doing my thing. And so I was on maternity leave, and I just decided, I'm like, there has to be a different way of practicing what I want. And that's when I discovered about DPC, and that's when this new project started.
I love that you call it a project, because these practices are our babies, but they're constantly needing work and needing care. So I love that you call it a project. Now, in terms of when you were watching, learning, taking it all in, all of these lessons about DPC from the Facebook group, as well as just understanding where your brother and his wife were coming from with their concierge practice, what did you envision as you were about to open Creekside Kids Pediatrics?
So I wanted my practice to be, and we hear this word a lot, a medical home. And that's really what direct care is. It's the direct access for the patients and patient families. And a medical home is a place where, your whole medical care is. So I wanted this practice to be comprehensive in that sense, that I was the go-to for answers. My patients and the families were not Googling. I mean, they could get a hold of me when they needed. And then also, as I mentioned, I started thinking about this practice when I was on maternity leave, and I'm a pediatrician. So, I envisioned the kind of practice that I would want to go to. This was my third kid, so I'd obviously changed pediatricians multiple times, but I do house calls for newborns through 3 to 4 months. And, it would have been great to have a pediatrician come to my house. And this was during the pandemic, and worried, scared, not wanting to take my kids into the doctor. So that's what I wanted. I wanted my practice to be, direct care, so direct access. I wanted my practice to be compassionate and complete care, that my doctor, like the doctor that I wanted to be, that I would care about my patients and show them that I knew their child and I wasn't just one of another number, and just convenient for the families. And so no waiting, no hassle, just timely care.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. Love that. That embodies your why, and that it really embodies the desire that we have as physicians to go into DPC. I mean, yes, it is a business model, but at the same time, we don't start out with, I want to make this much money, or like, it's about the quality of care that we can bring to patients. It's about the quality of life that we can have because we have DPC. So I just really love that. Now, after you envisioned your practice, after you had the why behind opening your doors, once you opened, how did patients find you?
So I think it was a little bit of a slow and painful process because there was no guidebook or just rules about starting this kind of practice, because like I mentioned, every DPC practice is very different. I mean, there's obviously similarities. So I think a lot of it was word of mouth. Already people in my community and my friends and family, so many people, as a pediatrician, you end up being the person that people text or call, or you're just like the go-to for, hey, I went to my doctor and this is what they said. So you end up being like that extra person to reassure them. And so that's kind of how, when I started telling people about my practice, they're like, well, I've never heard of this. And it's such a cool idea. And I wish, my kids are all grown, but I wish I had this when I was younger. And so that's kind of where it started. And then I did a lot of just in the community, in the neighborhoods, you have to remember, this is like the midst of COVID. And so I couldn't go and walk into places. And I just tried my best and to get the word out within the community. And, of course, just then online marketing and word of mouth, really.
Gotcha. And for online marketing, did you use things like Facebook ads, or what did you use specifically?
Sure. So I did use some Facebook ads, some Google ads, and Instagram ads in the beginning. And then I remember sending out like printed flyers and stuff, and it was just completely useless because I think the growth of my practice really was very organic. I had people approach me, like physician marketing companies, and to be honest, I couldn't afford them. So I was like, okay, let me see how this goes. And if I need it, we'll see. But it just grew very organically. And a lot of it was just word of mouth and, hey, my neighbor comes to you, or,
nice.
My friend, or, so that's kind of how it grew. And it's been good. It's been great, this last year.
Gotcha. Now, I want to go into your office. Can you please paint a picture for the listeners as to where your office is?
Sure. So I am in like typical suburbia. We're a suburb of Houston, Texas. The area is called the Woodlands, and within the Woodlands, I'm in the community called Creekside, and it's a growing community. It's a lot of young families. If you can imagine, kids ride their bikes to school, people walk to school, people play outside and walk their dogs and are running, and it's like typical suburbia. Where my office is, it's right on the main road of kind of that community. I'm located in like an office suites, like individual office suite. I'm in one of those. I also share space with a psychologist, and she has an educational background, which is great because we actually share patients, but I'm in the majority of the office. And like I said, I have no waiting room. We have big rooms. They're very child friendly. So kids, when they come in, they can like run around the office and, they don't have to be confined to like one room. I do have one primary exam room, which is kind of colorful and has some toys and, just place for the kids to kind of hang out and play. And then I have my office and a lab, and then we have an extra couple of rooms.
And in terms of your office, I want to paint a visual for the listeners as well. On your website, you actually have a picture of the outside of your office, the placard with your actual address on it, and then of the inside sign. And so I thought that you having those three pictures really represented that you were thinking from your patients' parents' minds, or your patients, if they're old enough, but that you you were guiding them visually into your office. So can you tell us about like, how did you go about designing that? Because I'd love to hear what your thoughts were when you put that on your website.
So where my office is, it is a little bit tucked away. It's not on the main road. So you have to kind of drive in there and see the sign. And so I guess that was my thinking, that if they see one sign, they can kind of follow it to the next one and find the office space. But I didn't really put too much thought into it. I just kind of went around snapping pictures in my office and posted those onto Google or Google Maps. But I hope that helps people find the office.
For sure. Yeah. I know I would know where to go if I were looking for your office. So that's awesome. Now, in terms of the clinic name, so you mentioned that your neighborhood is Creekside. So can you tell us about how you decided on your name?
When I went about trying to think of a unique name for the practice and I was just hitting mental roadblocks, I read some articles about naming your business or naming your practice and SEO. And if you're in a specific area, if you put the name into the town's name or the geographical name into the practice name, people are usually looking for pediatrician in Creekside or Creekside doctor. So that's kind of what my thinking was. I stuck kids in there because I just want people to know it's a pediatric office. There's a bunch of other offices in the area, dentists and others that have used the same name. So we sometimes get phone calls for each other because people think we're pediatric dentists, but that's kind of where that name came from.
Gotcha. And how about your logo? Can you tell us about the design there?
So I just thought that baby wrapped in a burrito is really cute. That's one of the first things that parents and moms, when they bring the babies home from the hospital. So it's essentially a baby swaddled. The colors were just, colors that I liked.
And can you share about if you go on vacation?
So I do have a covering doctor who is a family practice doctor, but while I'm on vacation, I always have my phone on. I'm still on call. I mean, my panel is small enough where I can still be accessible to my patients. And even I've traveled internationally and my patients have contacted me through WhatsApp and called me and FaceTimed me. And so I'm always on call. That's what I tell them. I'm here for you no matter what, where
Gotcha.
I am in the world.
Gotcha. Recently, there was another doctor who is internal medicine and she had gone overseas for, a good amount of time. And same thing. It was like the patients were still able to get a hold of her.
I think I was very nervous at first too. There are days where, it's very busy and I'm on my phone a lot. Because we're lucky and we have text communication, my patients they can text me pictures of things, rashes and quick questions. So I always tell them don't Google, just text me. If you have questions, or just give me a quick phone call. My phone is always on. And so initially, yes, I was nervous about that too. I have 3 kids of my own and I was like, how am I going to balance this? But my patients really do respect that, when it is after hours or weekends, they really do call or text me when it's an actual issue or concern.
Awesome. And now I want to ask about the home visits because that is wonderful. I do them myself. I absolutely love my home visit time. But for, a pediatrician to be able to do that, especially for newborn babies, can you give us a little bit of what it's like for your newborn home visits or any home visits that you do?
So I try to schedule my home visits for newborns even before the baby is born. So I tell my families or moms, expecting moms, I do actually do a free prenatal visit or phone call with them. So we kind of get the background about how the pregnancy is going, if there's any complications, to find out where they're delivering and all of that. And so what happens is when the baby is born in the hospital, mom or dad usually shoots me a text or an email. So we're kind of scheduled already. I try to do them early on in the day if they're okay with it, depending on what their convenience is. But that way I can kind of group them together so I'm not driving too far in the middle of the day, in the middle of my clinic day. And as far as getting things together, I have my core things that I need and my scale and my measuring stuff and otoscope and all of that. And just have a bag ready and go on the house call. And so it's been great. I love it. It's my favorite thing to do. I just love offering that service because, that postpartum period is just so special with the baby. And honestly, just right after having given birth, mom doesn't have to lug in their diaper bag and their car seat and have to drive somewhere or get somebody to drive them. And, I think patients do really appreciate that convenience.
Absolutely. Absolutely. I mean, when you talk about how, you saw your brother have that and you were like, well, I wish, I could have had that. I sit here listening to you and I'm like, I wish I could have had that because
Right?
it
Yeah.
totally, yeah, it totally makes a difference. I mean, for me, like I had C-sections and it's like, just, I had
Yep.
to have other people load the car seat to eliminate all of that. It's just amazing, amazing that you provide that service.
And I'll also you have to remember a lot of, I promote breastfeeding as well. And, I offer a lot of lactation help. And I'm not an IBCLC, but I'm hoping to get that certification at some point. But I breastfed 3 kids. And so, I just remember not wanting to go anywhere. Just, that first initial time, that first week, couple of weeks, you just kind of on your own routine. You haven't slept much. You don't want to be going into a germy doctor's office, So that's kind of where this thinking of house calls came into.
How many house calls do you have a week? Even, going beyond newborns, just for on any of your patients so that you can balance in-person care at your clinic with the home visits.
Mhm. So initially, when I started off, my panel was obviously much smaller. And so I was able to offer house calls for all ages.
Mhm.
I limit them to within 20 minutes driving distance to where my office is. But now I feel like because my panel's grown, I've limited the house calls to up to 4 months, except for some of those patients that have kind of grandfathered and that I've seen since newborns and, just special kind of circumstances. But
Yeah.
and so that's where I've kind of drawn the line with any new patients or new families that are joining. I've told them that the older kids do come to the office. And again, when they do come in, there's no waiting room. And so they come in immediately. The appointments are up to an hour long if they need them to be. So I just do hour-long blocks. And so if there's any other concerns or they need to discuss anything, they take their time and do that.
Gotcha. On your website, one of your services highlights that you treat ADHD, children with ADHD. So can you tell us about your patients? Who are you treating and the care that you provide for ADHD?
Sure. So speaking about ADHD, I've had training with ADHD patients since residency. I've worked with neurology, pediatric neurology, and behavioral peds. And then when I went to Mississippi, like I mentioned, I had a solo clinic, and there were actually a lot of kids that had ADHD. And so just as far as volume and experience there, I got to see a lot of different levels of ADHD and screening and diagnosis, and the steps with diagnosis and treatment plans. So as far as if a child were to come in where parents had concerns about attention deficit or not doing well in school or other things, so initially we start with screening tools, and then I also work with, like I mentioned, I have an educational psychologist at the office who has her own practice, but again we kind of overlap with some of the patients, and so she does the comprehensive testing for schools, and then we kind of bounce back, and I do medication management. So it's kind of like a good teamwork, and then she also does counseling. And so she does counseling with families and with the kids as well. And she sees through adult age groups. So, she has sort of a different panel of patients, but some of our school age kids are overlap. So that's what that kind of looks like. So in my practice, it's not just the medication management, you also get the counseling there as well as, so it's kind of like a one-stop shop. And then as far as developmental pediatrics, I've developed more and more interest in that field. And recently I got my certification to do ADOS testing, which is one of the tools that we use for autism diagnosis, and which was very exciting because, it's been a long time kind of pursuit of mine. So eventually at the practice, I would like to start doing some ADOS testing as well to help the community with autism diagnosis, which, during the pandemic, there was a lot of sort of gap in a lot of kids where they hadn't been to the pediatrician in a couple of years, and they were sitting at home and they hadn't contacted early intervention, or, they were just lagging behind in milestones. So I'm really happy to have done that certification, and hopefully in the future, I'd love to provide that to the community as well.
How do you handle routine childhood vaccinations at your clinic?
So I do have VaxCare. So I actually also vaccinate another DPC provider's patients as well who doesn't have VaxCare. So we kind of pooled our patient populations together, and we do have vax care available to both my office and then for her patients as well. And so they sometimes swing by and get their vaccines at my office. But we're lucky enough to have vax care, and which makes life very easy because, all that billing as far as insurance-based billing, and then also just, the inventory and not having to worry about that. So it's great.
Now, in terms of adolescent visits, how do you handle adolescent visits at your practice?
The benefit of having an adolescent visit at my practice is that, the visits are an hour long. So, we take everything very slowly, just going through all the, the checkup, obviously the history, if there's a sports physical involved, all of that. And then I take about 15 minutes with the adolescent themselves, with the parent stepping out of the room. They kind of sit in my office and hang out. So I can speak to the patient directly, and a lot of times a lot of stuff comes up and they open up about certain things, and just, with, especially with the last couple of years with depression and anxiety and, the stresses of having to do virtual learning and all of that, and social media. And so that's how adolescent visits are handled. And of course, then vaccines if they need them. And
Sure. And how do you maintain that relationship when they might not be in the office? I mean, in terms of, are they able to text you if they have any questions in particular? Do they go through their parents to access you? How does it work for them to communicate with you?
So I do actually ask the permission of the parents to share my cell phone number, because obviously my patient families, the parents do have my cell phone. So I ask them to share it with their kids if they're comfortable doing that. And then they can text me directly if they would like.
Gotcha. Now, I want to ask this next question in regards to where you are with your growth. You mentioned how, in the beginning you had fewer patients than you do now, but now you have more patients and you're needing to focus your time on their care. And publicly, you had mentioned about how frustrating it can be to talk with a lot of people that are coming from the public view, spending the time to talk with them about the practice, but then they, throw in oh wait, you don't take insurance. So how have you risen to that challenge of balancing that time with your patients and time to talk with people who are interested in your practice? And is staff involved in that solution?
So I don't have staff yet, but I think I'm pretty much at the point where I do need someone to help me, whether it's a virtual assistant or a medical assistant in the office. But I'm getting to the point where it's more and more tough for me to answer those phone calls back and, respond to new patient inquiries. I do have a little box on my website where they can plug in their information. And then email's the best way to kind of get in touch, because then I send out like an introduction email. And then if they're interested, then I send out the new patient intake forms. But as far as answering phone calls and speaking to people directly, I find it also I'm a little nervous about handing that responsibility off to, either a virtual assistant or, someone else, because I feel like I'm the best person to explain how this works and what the value is for these families. And sometimes they don't. And to be honest, they're surprised when I pick up the phone and I'm like, hey, it's Dr. Hussain, Creekside Kids Pediatrics. Oh, it's the doctor who's answering the phone. Oh, you answer the phone yourself. So, I think there's definitely a plus to taking those phone calls and trying to explain and, discuss the option for joining. So I have some, obviously my website has some information on there, but patients definitely have a lot more questions. So that's when I send out sort of like that email if they're interested, and that has a little bit more. And if then they're interested in joining, I send out the intake forms and they just join and sign the agreement. So that's
Gotcha.
how it works.
And are you managing all of those forms within your EMR? Do you use a form service like JotForm or Intake Queue?
I use something called Form Doctor. It's like Form DR. Just found it a little bit more user-friendly than some of the other ones. They had a service where you can pay to get them to format the forms the way you want. And so that's the one I initially started with. I think there was something else that I was using. I can't remember what it was, but I moved away from that and now I'm using this one. And they have an unlimited number of forms you can send out. So it's kind of convenient, because even if you send out a form and someone doesn't join, you can still send it out and you don't have to worry about reaching that maximum number for the month.
Nice. Yeah, that's awesome. Thank you for mentioning that, because that's a resource I don't think anyone has mentioned yet on the podcast. So as the word of mouth has grown, you have also continued publishing social media reels and posts and whatnot. So can you tell us about how do you throw social media into the mix within your work week, and what types of and how do you come up with your content? Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
So it's very random, and it's definitely not on any sort of schedule. Actually, I feel like I'm terrible at it, but I think if I was like maybe 10 years younger, I'd have more of a grip on it. But it's just kind of random, and what I think is funny, and sometimes I'll come across something on Reels or TikTok or whatever. But really, there's no science behind it, and to be honest, I have a lot to learn as to how to manage social media.
Sure. And in terms of engagement that you get from your community, who engages with your social media the most?
I think young moms, people that have kids in the community, that kind of find some of the stuff that I have on there is just like funny things my kids have done, like coloring on the walls or cutting their own hair. So, people kind of relate to that, because I just try to make it as real as possible. To be honest, I'm just one of you guys, just trying to survive each day, just trying to, take care of my kids and be the best parent that I could be. And just, but sometimes things don't go as planned. So that's kind of what my social media is, just very much just stuff I do day to day, and just trying to keep it as real as possible.
I think that's great though. And just the fact that you said it doesn't necessarily have a schedule, it reminds me of that idea of like, do I start now, or do I start when I'm fully prepared to do something? And the fact that you do it when you can, it's still working towards building presence in the community. And one more video of you living your real life and showing that it's going to be out there, whether somebody sees it today or, 6 months from now. It's not so much pressure added on your already busy plate. And in terms of your Facebook page, one of the things I was really impressed by is that you also have appointment slots on your Facebook page. And you also have a bot responding to inquiries on your Facebook. So can you tell us about how you develop those aspects of your social media?
I'll be completely honest with you. No one has ever used the Facebook appointment bot.
Wow.
Whatever. Yeah. And it's all my appointments either new appointments come through phone calls, or if, someone reaches out through my website. So if somebody messages me on Facebook, there is that, the automatic response, but then I go in there and check it from time to time and kind of respond, hey, it's me. And how can I help answer questions? Give me a call. So a lot of it is just personal, just phone conversations.
And then you've mentioned just now how you are portraying your actual life on your social media. You have 3 children who are younger than 12. How do you go about balancing everything? Because you talked about how, you were nervous initially providing 24/7 call because you have a family. So I would love to hear, especially for those people who are parents of young kids who are looking to do DPC.
I think it does being a DPC provider offers more flexibility, actually, in terms of I'm able to schedule sort of, of course, I'm available to my patients, and I do have still set clinic hours. I'm here, between like 8:30 and 4:30, but, I do the after hours and things like that too. But overall, the flexibility that this kind of practice has offered me has definitely been more than a practice where I was going in the morning and coming back, seeing back-to-back patients. So I have gaps in my day where I can run my errands or just do other stuff, which is definitely not there when you're a full-time fee-for-service provider. But I've just tried to balance it as much as possible. I think that there's definitely more flexibility. I'm able to go to like school events. I've participated at my kids' schools for, different things that I could be the physician at an event, a pediatrician at the event. They need somebody, fundraisers and things that they've had at the school. So sometimes I wasn't able to do that at my other office because it was just, patients are scheduled and they're double booked and, you don't have time to even step out, but it does give you flexibility. And I think if you do offer at a DPC practice, if you offer that text and call communication directly to the provider, there's a lot of little things that can be managed over text and phone call. Sometimes I have multiple text conversations with patients throughout the day. I mean, it starts in the morning, but I don't have to see them because I can kind of manage them over over text. And so it definitely provides you a little more flexibility, I feel.
And I mean, you speak from such experience because your eldest is 11 at the time of this interview. You've been in practice for years. So you especially have seen how it is to balance having children as well as fee-for-service and then DPC. So I think those are really, really wise words. And you have the experience to really reflect on both models of care while having kids. So for those people who are listening to this episode and are in medical school or they're in training to be a pediatrician, they're in residency right now, what would you say to them in terms of, they've learned about DPC, they're interested in doing it because of things like flexibility, in terms of autonomy, in terms of, being able to take care, really, really good care of their patients. What words of wisdom would you have for those individuals in particular?
I actually gave a talk to some of the pediatric residents at Texas Children's a few months back. It was more of like just a question answer session for them to learn more about this kind of practice. And, they had a lot of questions because even as a resident or, when years ago, I mean, we didn't know what this kind of practice was. We didn't have any exposure to it. Some advice I would definitely give, which I think the newer residents are getting lactation training, which we didn't. We had an informal lactation training, but we didn't have that as a formal, certification. So it's very helpful as a DPC pediatrician to have that knowledge under your belt because you sometimes are the first line for answering those questions for mom and establishing breastfeeding early on in a newborn's life. So that's one. And then again, like I mentioned, developmental pediatrics, trying to get as much, training in that. So that would be some of the advice. And then if you're interested in primary care, this is a great way of practicing medicine. I mean, this is, really it gets down to the core of what primary care is supposed to be. It's that relationship between the patients and the patient families. I mean, I know when I get a text or a phone call or specific kid is sick. I mean, I know exactly who that kid is. I don't have to go open the chart and find out, oh, I don't remember when I saw this child. And that used to happen to me. That was me when I was seeing 30, 40 patients a day. I, sometimes wouldn't remember somebody if I hadn't seen them recently. So this really brings it back to you being that doctor for that family and just being that go-to person and just building those relationships.
And I just want to ask you there, in terms of when you talked with the residents, how did you come across that opportunity?
They actually contacted me. Their program director reached out to me. They just sent me an email and they said, we're looking for DPC pediatricians. Would you be interested in speaking at our rounds or I think whatever their lunchtime meeting was? And they just emailed me and I was like, whoa, okay, sure. I'd love to.
That's amazing. And I definitely encourage people to do that because especially for people who are early on in residency or in medical school and who can plan financially, who can plan emotionally, who can plan with their families to open up a pediatrics practice or another primary care practice in DPC, even specialty care. It's just, it really, I say this because I spoke with my old residency, the current residents were just like, okay, this is like, you sound like you're happy though. Like none of the people who've talked to the residents have been happy. And I was like, you don't understand until you see, and you hear what we as physicians who are doing this model are really feeling and experiencing. So I encourage people to reach out to residency programs, to explore any option you can to reach medical students nearby or residencies as well. And in terms of taking that question to somebody who, like yourself, was already in fee-for-service, would you add any more words for those individuals in particular who might be hesitant or afraid to do direct primary care because of all of the reasons, the financial reasons, the balancing family life? What would you say to those people in particular?
Sure. I've actually had a few established pediatricians who have had very successful fee-for-service practices in the area reach out to me and ask me so many questions about this model of care, and that they're thinking they've been years into practice and they've heard about this and they're thinking of transitioning or having some sort of hybrid model. And so I've been able to kind of, give them at least my approach on it and my experience. But, when they hear how happy we are as a group, all us DPC pediatricians and family practice and all the DPC providers, I think that's what draws them to this model of care is like, hey, these doctors have a work-life balance. They're actually practicing the way they would like to practice. There's no constraints on them. There's no middlemen. There's no insurance stuff. So, I think there's definitely a growing awareness, and I'm happy to answer any questions for, doctors that are looking to transition or exploring this option. I think it's great to kind of get that, because a lot of doctors haven't heard of it. They're like, wait, we don't know what this is. What's DPC? And so once they learn about it, I think it's great to raise awareness and tell them what I know about it, at least.
I love that. Now, I want to ask about the fact that you are approaching your 2nd year anniversary. You've mentioned things like, you learned the lesson about mailing out those physical brochures. I want to ask, what high-level advice would you give looking back on your time in practice in your DPC so far that you would advise others to think about going into the future?
So I think for a small practice that's growing, especially with the DPC practice, I would say keep your overheads as low as possible. I started very small. I think one of the things that maybe I made a mistake with was my space was kind of larger than I needed. And I was obviously paying rent for that space. So I ended up subleasing part of it, which, kind of cut my overheads a little bit. And having some sort of, business model in place before you go into the actual practice. I guess for those physicians that already have an established practice, definitely putting feelers out there and doing polls of how much interest there is in those patients wanting to join a DPC practice. I think that would be helpful before you kind of transition. And then, like I said, just keeping those overheads low, just kind of, starting with the bare minimum. You don't need a lot to start a practice. You just kind of need the essentials and then growing it from there. And then you kind of have more luxury to kind of add on always.
And are there any cautionary tales that you would like to share as well?
So initially I hired somebody to make my website, and it didn't turn out the way I wanted. There was just, I don't know, just a lot of mistakes, and I never actually got that money back either. So I ended up just going and making my own website. It's actually pretty easy to make your own website now. You just can use some of the programs like Wix. That's what I used. And it's pretty easy to make your own website. I had no IT background whatsoever. And a lot of people do have IT background, or they're definitely more technologically kind of knowledgeable. And I am definitely not. But I think sometimes just hiring the wrong people to do certain things can get you into just do your homework. Maybe use somebody who's already been kind of tried and tested by another doctor.
Awesome. And going into the future, what do you foresee in addition to the autism aspect of care that you're bringing to your practice? What do you see for the future of Creekside Kids Pediatrics?
I'm definitely looking into and in talks with a lactation consultant to come on board and offer their services. It's like a collaboration. We also have a team of PT, physical therapists and occupational therapists that we're trying to, they wouldn't be employees of the practice, but we're looking to collaborate with them so our patients have that comprehensive, like I said, one-stop shop where all their kind of child's care can be taken place. So we have the space at the office. I'm hoping to expand and offer those services as well, nutritionist as well. And then I'm also looking to get my lactation certification at some point. So adding that on.
Amazing. Well, thank you so much, Dr. Hussain, for joining us today.
Thank you so much for having me.
Next week, look forward to hearing from Dr. Marty Schulman of Encinitas Personal Care in Cardiff, California. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.